Hi, everybody. Welcome to our webinar today. I'm super excited to talk about internal agencies. We have one of our industry leaders that have been doing this for quite a while joining me today. So I'm Becky Kahn, Vice President of Client Solutions here at Trusted Health. We're a digital platform technology company that's built some great technology for healthcare organizations to use to manage flexible labor. And I'm joined here today with Laura Frickler, and I'm so excited that you're with us, Laura. You've got a long experience in this and have been speaking about the great work that you're doing there. So why don't I give you a few moments to introduce yourself?
Well, hi, thank you, Becky. So my name is Laura Fricker. I work for Johns Hopkins Health System for interest staff, and we do manage what we'll be talking about today. So internal and external temporary staffing. We staff clinical and non-clinical throughout the health system. So it's a varied job. And of course, right now, the big conversation is with nursing, which is what we'll focus on today. But we do cover both clinical and non-clinical, and our model works across the board. So be excited to talk about that today with everybody.
Great. Thank you, Laura, so much. So let's go ahead and get started. So today's plan is really talk about why the benefits of building an internal agency and specifically what Laura's done there at IntraStaff, where they outsourced their contract labor management and brought it in-house. The strategies that she used in developing that program and the success that we've seen coming out of it. And really why we're doing this today is as we exit the pandemic, and I just attended the Leap HR conference last week, and there's definitely been a lot of discussion about how the organizations need to be more creative and more flexible coming out of the pandemic, and looking at a way to decrease the spend that they used during the pandemic with contract labor and reduce that cost and become more flexible and increase their internal fill. And we're seeing that happen. So for those of you that follow Becker's, definitely been a lot of coverage recently on organizations across the US that are looking into doing something similar to what Johns Hopkins did many, many years ago. And really looking at how do they build their own internal ability to recruit themselves, but offer and track those candidates as they bring in and be able to streamline it and not add a lot of staff to help automate the processes. We know that it's no secret that nursing specifically, as Laura said, has gone through a pretty major crisis, and we've seen a lot of reshuffling happening in healthcare in general. And the nurses that are staying, we're seeing a large number, a high level of turnover. Some recent reports have indicated as high as 25%. And we expect a pretty significant shortfall of supply over the next several years. And those that are staying want more flexibility. They want to be able to work different types of hours, be able to move around their organizations to different units and different facilities, retain the benefits and tenure, but tracking and allowing this flexibility has been difficult. The systems that are used today by many health systems don't allow that to easily be tracked. And we're seeing some technology emerge that allow organizations to better automate those processes. So nurses experience, again, high levels of burnout, and the surveying is telling us that they want more flexibility. They wish they can work different hours. They want, and an in-house agency allows you to customize and implement some of those programs and be able to recruit from your local markets and be able to provide some of that flexibility that's looking, that candidates are looking for, specifically nurses specifically. We hope through that flexibility, and I'm sure as Laura's going to talk about, we'll see, the ability to retain talent, see higher conversion rates to perm if they're externally sourced, and if they're internal, see increased retention and increased participation in shifts and things that are happening. So the benefits to the employees are huge. So we know that they, again, by creating that internal capability, you get more flexibility. Candidates can learn different skills as they move around to different units and different work settings. And if they're interested in internal travel, they can also earn competitive pay while retaining those benefits and that tenure that they have in your organization. But the benefits to you as well for implementing this internal agency are huge as well. So increased retention and satisfaction, increase brand and loyalty to you, increased training opportunities, and again, ability to reduce that external labor cost. So as we look at pre and current and post pandemic, I mean, I think the focus now is really balancing the workforce. So, pre-pandemic, it was predominantly core staff. Everybody has some type of flexible labor that allows you to increase your staffing levels with your census fluctuations. So a combination of travelers or external labor as well as internal labor. During the pandemic, which we have as current, I think hopefully we're starting to exit that just a little bit, although I've seen some recent numbers it's starting to creep back up. So I think a lot of us are watching and learning and seeing what's going to happen. But it definitely went the other direction where you had a high number of travelers that, and many that left internal resource pool. We've been hearing from clients and leaving to go exit to travel. So you had a high chunk of travelers working, smaller amount of flexibility, and then your core staff decreased as well through burnout and different units that were shut down, et cetera. So now we're coming out, and what we're seeing now is, again, a smaller amount of travelers, but a more increase in internal flexibility, internally working with your teams to create those shifts and that flexibility that's wanted through an internal agency or internal travel type program. So with that, the how, so the strategy that makes in-house agency programs, and if you have an MSP and you want to look at bringing that in-house, how do you do it? And that's what I'm going to turn it over to Laura right now to talk about how she's done that and what the secrets to their success there at IntraStaff have been.
Well, thank you, Becky. So here we go. First and foremost, we're a licensed temporary staffing agency. We actually started that way. We started doing that before we were managing all the temporary contracts. So this is actually our bread and butter in our beginning. So one thing it does let us do is it lets us we use lower charge rates than the competition, meaning all the other agencies, because I do have the opportunity to charge somewhat differently, and I'm really just about surviving, not making a profit. So that's why I can charge quite a bit lower, and our average charge rate for a nurse right now is less than half of what our average travel rate is. So it's significant. It's not an insignificant difference. It's incredible, actually. And we have opportunities for retirees and dual employees, and that's an important part. And I think as we get further along here, retirees are getting to be a bigger and bigger force in the workforce. So looking at, can you capture those people before they're really gone, or are there special projects, especially among leadership, director level, vice president level, that sort of thing, that these retirees can perform for the system. And so we manage all of those people, the payroll and all that, sort of the employment parts for those people. And then dual employees, also very important. When you have a larger health system and you have people working from one area to another area, it allows for that flexibility. And we will pull them into our temp situation, to our temp system, and then they can work wherever they want to outside of their normal jobs. Lots of rules surrounding, but it's a great group of people that we work with to make that happen for us. Let's see here. Support local communities, including minority businesses. This is a really near and dear projects for Johns Hopkins. We really believe in supporting the local zip codes around our larger facilities, especially. And it allows me to do that. I have control over who I hire, control over which agencies I work with. And I do work within certain zip codes, and it's important to our overall mission. We find that to be very important, and this is a good way to do that.
Yeah, I love that part of your program and the ability to really engage with those local employers and build, because those are where our employees are living. And if they can choose the difference between onboarding locally through local and stay local and working still with you, it's a great way to meet that need.
It allows us to really look at opportunities, right, for people. And that's the important thing. Like, if I can get you to come work for me, come work within the institution, then there's endless opportunities. And a lot of people have found wonderful growth that way. So we're really proud of those programs. That's the cool stuff, right, where you get to do those sorts of things. Let's see here. So
100%.
many temporary staff converted to perm every year. Again, this goes back to supporting local communities, but pre-pandemic, and Becky and I were just laughing about how statistics are so screwy right now with pre-pandemic and post and peri-pandemic sort of numbers, but our pre-pandemic conversion rate into perm roles was 50% or even better in certain areas. So, really the people we're hiring into work, managers are finding that they like these people, they want to keep them working, and they'll find them a position. So the conversion rate's really quite high. Yes, so we're talking about our business support, and we have clinical recruiters. They work together to really figure out what we need and to really have the right mix throughout the institution. And this goes with being internal, right? I know what's coming. I know what the ask is. I know what's the hurry and what we can wait on. And so we can price things and recruit based on some of that insider knowledge. And it really helps quite a bit.
Yeah, I like that. I think that's one of the benefits from bringing it internal. You're able to move quickly as you meet with the leaders across the organizations, and you can implement those changes and those projects fast. And again, as you have lead time, you can take time, you can ramp up, and that allows you to control cost and rates as well. And really, sometimes when you're working externally, it just takes time to communicate that and get it implemented.
Yeah, to really understand, to get a sense of what the real urgency is, or what's really not that urgent, it can be really important. And being a part of the system, just having, even just rumors help sometimes, right? To know what's coming, or to see, we have something planned or something's coming, to kind of, then I can start thinking about it and start thinking about how am I going to change my strategy in 6 months to match this requirement. So.
Yeah, I love that, Laura. I think it's a huge benefit. So one of the things that I don't know if many know, so while InterStaff's been in place since the late 80s, you all were definitely way ahead of your time in setting up your own independent agency and recruiting. You did at one time outsource your MSP relationship and used an MSP, but you brought it in-house. So talk about kind of why and what the decisions were around that. And why you did that, Laura.
We'll talk about that. It is important that, so standardizing agency contracts throughout the system so that I get a sense of what the contracts say, what they are. And, we don't use any subcontractors beyond those. Like if you're contracted with me, I don't use a subcontractor of yours. So I know the relationships, I know the people, and we have standard across. Like I said, we're talking a lot about nursing today, but we do this in all areas of the needs and all throughout the health system. So, to understand the people that are supplying your EVS, and to really allows for large companies and small companies, local, minority-owned agencies to have a seat at the table and to really have the opportunity to offer work. So that's again the fun part, right? To really make sure you're drawing all sorts of people into the system, and that's to our great advantage. We do build agency scorecards to evaluate performance, and it really works out for some people and it doesn't work out for others, unfortunately. That's important. It's important that agencies understand that we're watching, and that, a history of failure and compliance, for example, is going to result in no longer working with us. It's, expectations are high, and I get that some of those things like compliance are very challenging, and we're very open to conversation and very open to working with somebody. And it's the people that have good communication skills and keep us in the loop that we're very successful with. Those who don't have, you can tell right away whose leadership structure is lacking, or who don't have good communication skills among their office, you can tell. And it's not always worth your time to sort through all of those challenges. They can get their office together and come back, but we'll stick with the people that are working in a way that works for us. We create a level playing field between agencies. That's a big deal. You want the big guys to have the same chances as the little guys. And really, some of the little guys have helped us very much through the pandemic. Some of the specialties, and the big players as well. I mean, you really need the whole, everybody coming to the table to make sure, if I need a whole bunch of nurses, I know I'm going to have to go to somebody big. But if I need that one weird specialty, I might go to somebody small who's really got that niche and really knows that area. So it takes the whole group and knowing your agencies and who's got what strengths, that's a really big deal. Managing agency rates using benchmarks. So looking at local and national, and we I'll take everybody's data, whatever you got, throw it at me, right? Because I do a lot of comparison. Certainly our partners at Trusted have been fantastic to work with. And I work with a lot of the other agencies as well. We work on the nursing board. So, I have my own profiles out there. Sometimes I'm Laura Fricker, sometimes I'm Laura Lefkowitz, my old maiden name, my other name. So, but we're on all the boards. So I can see what the actual offers are and think regionally and really think about, okay, so across the street, what are they offering? And of course, I have friends all over. What are you doing? What in this conversation? Just talk to my friends in Boston, talk to my friends, on different areas, and just say, what do you see? What does it feel like? What's sometimes the anecdotal is really important, and the numbers aren't even as important, right? So it's what are you feeling this week? Does it feel like it's working? So it's really helped us lower some rates and to be mindful of what we're doing, right? That's a really big deal. Our nursing contracts are managed by RN account managers. So, and what I mean by that is that the internal managers all work with one of our internal RN account managers. So the match is really good. A lot of agencies do a very nice job of saying this MICU nurse will probably work in your MICU role here, but they don't know that MICU, which sort of sounds silly, but every hospital is different. Of course, Johns Hopkins being no different than many systems. We have, the academic settings, and we have more the community-based settings. And it's a very different, it's apples and oranges some days. So really having RN account managers that have worked in those areas, that know those nurse managers, and really have, a feeling for what they're looking for has been successful for us. So it's an expensive way to go, but having account managers who are RNs has been really good for us.
Well, and I think it's good for the agencies as well, because it gives that when there is that question by a nurse that's interested, but they may have that unique question, they know the answer, and because they're intimately involved with those unit managers and can answer it directly. So I think it helps the agency on that side as well.
Absolutely. You can do the rah, like what cool projects we're doing and what's cool about this unit and stuff like that. So that's also the sell, right? When we put something up there, if there's something really cool going on, we can recognize that. So.
Yeah, I agree completely. So as you transitioned, especially both managing your internal agency, but also taking on bringing your contract labor in-house, technology had to be a key component for that. So talk about how you use technology and a vendor management system to help enable your work.
And it does. You need to start there, right? And I think I've said before that it's almost surprising the resources that are required. But really, if you want to have good data to spit back at you, you need to put the good data in, right? So you need to have the ability to track all of this activity, and it is a lot of activity. I mean, there shouldn't be a spreadsheet in your hand, right? This should all be something that you can come back to and do robust reporting. I mean, that's a big deal to understand all sides of the business, and we go all the way, right? So we do reverse invoicing for our agency partners, and so for us to keep track on the invoicing part to the agencies, and then also the charge to all the units, and we do unit charges all the way through all these systems. So you can pull all that data at who worked where, when, and how long. So you need to be able to pull all that very quickly, and it's surprising the resources it does require, but you just kind of have to start there and make sure that you have the right systems in place.
And I think what's unique is, vendor management systems have really evolved over the last couple of years, and it is allowing organizations to bring it in-house and automate it. So maybe in the past it took, 20 people, and currently, depending on number of facilities and size, it's taking half or a third of that. Trust is proud that we do have a technology that helps enable all of this, and that's what we've seen decreased number of people it takes, but as long as you can automate more of the processes. So talk about compliance as well, especially as you're moving people around from campus to campus with even internal travel programs. We've heard the hardest thing is keeping the unique compliance requirements as they move to different units and different facilities is hard in most HR systems. So a VMS really helps automate that process.
So at Hopkins here, we're fairly centralized. So in fact, our compliance is pretty
standardized. You're ahead. Yeah.
Board. So that part really works for us. which you're right, making sure that it's all complete, accurate, up to date, like that's no joke, right? And it's not the romantic, exciting place to put your money, right? Nobody grows up to think they want to be a compliance specialist, right? That's a really hard job. And, but it's so important to put the time and resources to make sure that you have those pieces perfect. Joint Commission doesn't care that you were 90%, that was an A-, right? They want an A+. And that's a big deal. So absolutely, the full-time monitoring of expiration dates, we really work hard not to staff anybody every morning. That's, you're constantly looking at it. We on top of all of our contracts, we also do endless PRN shifts. And those PRN shifts very often are booked at the last minute overnight with our on-call staff. And they know, you get a little red X next to your name, you're not working. We gotta investigate that first. So it's a very big deal. It takes a lot of time. And again, you've got to invest in the resources to make sure you not only are you managing the compliance, but you're chasing people to be sure that it gets updated again, right? So it's the whole give and take of all of that.
100% agree. And you spoke a little bit to data already, but how important does a VMS help you be able to pull that data and give it to your stakeholders?
Well, it's a big deal, right? Especially as we've moved into this whole pandemic and all, we all got slammed with it, right? So how much money went out the door, and just the rates, and everybody just, your mouth, the first time you went to 200, your jaw just dropped, and just, I can't believe this is where we are. So to really be able to look at where the spend is going, where the need is, and combining all that with your information from the outside to say, okay, this is what the rates are locally, this is what the rates are nationally, to be able to pull all of that data together and compare yourself to the local rates, compare yourself to the national rates, compare yourself to how desperate are we today? And do we need to go up on our rates, or do we need to go down on our rates? So we look at all that data, so fill rates, how long does it take? I put a job out there, how long does it take for me to get 5 submissions? If it takes less than 24 hours or only takes 12 hours, then I probably have a nice high rate, right? If it takes more than a week, I'm probably going too long. So all of that data pushed together. And then of course, we talk about, sending that to leadership and to really say, we have where we go, the one-stop shopping allows all the data. So same sort of thing. So, each institution needs to know what they're spending, and the entire health system needs to know what they're spending. So we have it all in one spot. I send out the monthly report. Everybody knows, everybody gets that information. And that we can make plans. You can't plan if you don't know, right? So
yeah, exactly. I think the key that you said too is that you can look at submission rates and what those look like, and you can adjust on the fly yourself, which is hard to do when you're working through an outsourced partner, or even via spreadsheets or email. When you have a technology platform that you can go and adjust the rates, auto distribute those jobs in a standard format, allows you to keep all of that straight much easier.
Correct.
So
yeah, and you can pinpoint, you can pick that one silly job that's, for whatever reason is a tough fill, and that could be the one job that goes up. So you can really be very specific with what the jobs are paid, or the rates are. Inspiring confidence. The confidence part's really important. We all have to have our leadership buy-in, right? That's number one in a lot of ways. So as we're working together, and we're coming up with these crazy ideas, and we're talking about these crazy rates, and we're talking about cutting rates, and you really have to be able to be right some of the time and prove yourself with all that data, right? So that people have confidence in what you're doing, and to say, listen, no, we need to go to 200, and these are the 5 reasons why. Or I'm going to cut rates to 130 and making this. I'm going to cut rates to 130 in this area, and these are the reasons why. Like, I have all this data that I can show you. Have this many people, their contracts are ending. The cancellation rate for new rates is 2%. Like, let's cut these down. And pulling all that data together really inspires a little confidence, like we're doing the right thing at the right time for the right reason, right? So you gotta
or you've recruited that local person now that's going to fill that opening through your agency. Now they become a perm part of your core staff. So it's going to be an amazing feeling.
Yep. Again, I'm sorry, Becky. So So recognizing the need for change and the plan to make it happen. I mean, again, that's because we have good data and work really hard to make all those puzzle pieces fit, right? You got to make it make sense. If they're visual people, make it visual, right? You have to pull all those data points and make sure it makes sense for your institution at that time. And like I said, through the pandemic, we really discovered that having all those data points and really working hard to understand where we stand helps us plan and helps us to know exactly what moves we need to make. And it helps with leadership buy-in. If you've got a good plan, regardless of what it has to be, which sometimes it's not a fun answer, right? But if the plan makes sense, then everybody feels more confident about it. It's important.
And I think here we're talking about, as the world is changing and you're looking forward, we're hearing, again, we were at LEAP last year, and we're hearing from lots of organizations that they need to build a different way to do it going forward. And building that internal agency, being able to manage and stand up and recruit locally, provide that flexibility, manage that conversion, allows you to be a visionary and build your brand in the marketplace. Talk about how that's happened with, especially interest staff's been around for so long.
Right. Well, and that was, and it was visionary in the years. I mean, it's 35 years this year. So it has been around a long time. Started out as a nursing float pool as a way to capture people, to not lose people out of the system. And really, you look at employment right now, and we had you had that slide a moment ago that looks at flexible workforces. That's the piece that we need to be sure that we're addressing, right? And in my role, that's our crew, right? The flexible. We have travelers, but I really want to work on the flexible group. So you want to capture everybody. You don't want to lose anybody. The retirees that have so much institutional knowledge, what can I do to keep them in the system a little longer, even if it's very part-time? What can I do for people that are, well, nurses are mostly women, right? So we can say a lot of women have a lot of family concerns, a lot of education concerns. Sometimes you have to make it work for your life, your family, as well as your career, right? So as you build flexible workspaces, what can we do as, using flexible employment to keep someone in the system? I don't lose you just because you only want to work once every 2 weeks, right? Maybe that's as much as you can do right now, but that's a value to the system, right? So these types of programs allow us to do that. And that's a big deal. It's about keeping everybody in. We don't want to lose anybody right now.
Yeah, I think definitely, as we're seeing the big reshuffle happen. So Laura, we thank you for your time. This is a great time for anybody that has questions. Laura's here and we're available. There are two ways that you can ask questions. You can do it directly through the Q&A channel by going to the bottom of Zoom. Laura's free to answer any questions, or myself. And then we also have the chat feature. So love to open it up and see what questions we may have. Let's see. Usually we have lots of questions. I don't know, Laura, I think while we give people a chance, I know you've done this talk a couple times this year. What are some of the questions that you've been asked that maybe you can provide some input on?
So usually it starts with, how do I start? So we want to start this. How do we do that? And there is lots of ways, looking at the needs. We do have the two sides. And so we are a staffing agency, and we are also an MSP. So, which side works best for you and your team? Do you want to start as an internal agency? That's really cool. There's certain ways to do that. Certainly, between getting licensed in the state and all those sorts of things, and understanding that, that's a big employment question. So you have to do the advertising, the hiring, the payroll, all of those pieces. Benefits, do you offer benefits, all those sorts of things, or do you start as an MSP, which is also very important, right? So, do you want to start with understanding and managing nursing contracts, which you can do a lot of good in that area as well. Having both sides for us has been advantageous, because then I can keep a track of it. If I have an internal, I put them into that travel contract and I save a lot of money. And so I know where all the needs are. At the same time, like we said before, we really work with our agency partners to make sure we're paying the correct price and everybody has a seat at the table, right? So it's it fosters a little competition, that the account managers, you got to play the recruiters a little bit one after the other. They get paid for a placement, not by sending you somebody. So they'll send you their best placements if they think that they have a chance of getting those people placed. So I think it also drives quality.
Yeah, I agree. So we do have our first question is your internal agency a cost center within the health system, or do you set it up as a for-profit?
We're a for-profit, not a cost center. So I do a percentage of each of those hourly contracts, each hour. It does vary for how much the person's making. So I would charge for an EVS person, food service person, entry level type of job, a little bit differently than I do if I have a senior VP working 8 hours a week. So the charge is a little bit different. It's scaled in different ways. And it does have to do with, how long the contract is and some of those other pieces. But yeah, we are for profit.
Great. Another question. It seems like there is a major agonism between travel agency and facilities. What do you think the best way to work together going forward so that it is less of a zero-sum game?
So I think there's a couple of things to do. Is one, to understand that agencies, and Becky knows that I know this, they have to make money. That's just that's the cold hard reality. Health systems have to save money. That's the cold hard reality. So you just have to understand each other and to know that the salesmen are going to sell you stuff, and that's their job, and that's totally cool. Like the recruiters, they need to push. They're going to, like my account managers, they're pushing. I'm like, of course they are. That's how they make their money. That's how they eat. That's how they feed their kids. Totally cool. Ours is a little bit different. I need to save money, and you just need to find a middle ground. You need to understand what a good price is and hold it and say, hey, listen, I know you think that's what it should be, but this is where I am. And because I have competition, I'll get somebody else to fill it. Thank you. And it's just a matter of understanding where everybody comes from. I've talked about it before, the nursing boards out there where nurses can look up the highest rates for which contracts they want to do, really pitted health systems against each other, especially in the same areas, right? Like I didn't compete with California much, they didn't compete with me much. But if somebody across the street, within the state of Maryland or local Pennsylvania, New Jersey, you pitted us against each other, you just have to be really careful not to get into that game, Yeah, you got to avoid it because it's losing, right? Because then one person goes up 10%, one person goes up 10%. You just got to play it off and let it sit and let them fill, and then your fill will come.
Yeah, I agree with that. So another question, what was your agency usage volume when you did transition to bringing it in-house? And how long was that process, like implementation time-wise? How long did it take you to, in the relationship, bring it in-house, find a VMS, kind of implement that? And did you see volume, pricing? And again, I think this is pre-pandemic.
It took a couple years, right, from inception to moving it forward. So we went live with our MSP in May of 2018. I'm very, very grateful that I had those 18, 20 months before the pandemic, because we went from a couple hundred contracts to well over 1,000 nursing contracts. So just to have the team to learn how to manage and to develop relationships with not just agencies, but also internal managers that had never requested help before, right? There were a lot of managers whose units were very stable, and this is true across the country, this was new to them. Some educators, they'd only done a couple of travelers before, really didn't have training programs in place to say, yep, every week we have training, every week we do this. It was once a month they would invite a few travelers in, so it took us a couple of years to get the system up and running, to change over contracts, to negotiate with the health system in terms of what they wanted and how they wanted to do it. And then thank goodness we had a year and a half plus to really get our own processes and our own systems in place so that when the pandemic hit, which none of us knew was coming, so when it did hit, that we could pivot, the word of 2021, so we could really jump in and make it work. And there were lots of tears, lots of struggles. We worked too many hours for a lot of days, just like everybody else. But now I think we're at sort of a low roar, kind of sitting at this steady state right now.
Yeah, so one other, two questions probably in follow-up to the one that you just answered, but going back up really quickly. So when you indicated you set up a for-profit, it's a subsidiary of the health system?
Correct. So it sits under the umbrella of one of the umbrellas of the health system. So, it would be part of some of those profit-making companies, right? So, like doctor's offices and some real estate, insurance companies, things like that.
Great, that's helpful. And then as you brought it in-house and you looked at a VMS, and what type of personnel and expertise did you need to bring it? I mean, I think you were a little different to bring it internally and run it yourself. So you had an agency already stood up. Maybe most don't have
Yes,
that. So,
right. So it wasn't quite the same for us. Yeah, I think you're right, because we were already supplying nurses to the system, not in contracts, because we did have an MSP within the hospital system, but we were already hiring people, and certainly not even in nursing. Putting people into contracts throughout business support. So we had some of that experience, and we knew a lot of the insiders, right? So the people. I worked within the institution for 26 years before I came to this job, so I know a lot of people within the hospital system, and you can leverage those friendships to say, hey, listen, tell me what's going on, and that sort of thing. So.
yeah, we have a large client that brought in-house recently, and they manage with a good VMS, 35 suppliers and 200 working candidates with one person. So I think technologies come about, and I think, Laura, your model is a combination of your local agency and bringing in all those resources, and then seeing that you have the ability to bring it in, and with additional technology, you can automate that process as well.
Right.
What is the biggest struggle with operating an internal agency? Is it the recruiting? Is it compliance? Do you have many of the same struggles and challenges as external agencies?
I'm sure it's almost exactly the same, the struggles, right? Um, because we are, and we do the same thing. I have a recruiting group. They do their thing. They advertise. They go on LinkedIn. They do they do all that. Um, the compliance group. And we saw this. And Becky Trusted did a great job during the pandemic to say, hey, listen, you guys pushed back and said we're not staffing in less than 4 weeks, because compliance is really important, and it's not the glamorous place to put your money. You guys recognized that early to say, hey, listen, our compliance is falling behind because we're all ramping up so fast. It was
Yep.
the fastest ramp up any of us could have possibly imagined. And so compliance fell off for a lot of people. And it was important to recognize that we need to put additional resources into a non-glamorous area. You don't make any money on it, right?
Yep.
Yeah, and to put money into that area. So, I think that we actually have very similar challenges. Probably compliance is a big one for us, because for internals, we know how to do it, right? When I'm hiring somebody, we do our compliance. As we have agencies we work with, especially new agencies, we've never decreased our compliance throughout the entire health pandemic, never decreased our requirements, never came with a quick solution where we placed people and then got them compliant. We never did that. We were able to march along the beat of our drum here and just say, nope, I'm not interested until this person's fully compliant. And drove a lot of agencies crazy, but because of our competitive edge, and I think the name a little bit, Hopkins being what
Yeah.
it is, people still wanted to come, and so they were willing to take the time to really fulfill all those compliance requirements.
Yeah, I think that's some great takeaways. I think the ability to stand up your own agency, manage it, allows you to really establish your brand, create, your own expertise and your vision as an organization, and allow you to offer that flexibility that the market's looking for. Well, it doesn't look like we have any other questions. I can give it one last call. In the meantime, if you want to learn more about Trusted, again, we have a digital travel marketplace, but we also have a technology platform that you can use to enable all of this. Reach out to me. And then Laura's always willing to connect. Here's her LinkedIn. She's been doing this a very long time. I think is a leading expert in this industry, in this area, doing this, and loves to connect, and would be happy to talk via LinkedIn and connect with anybody that's interested in reaching out.
That sounds great. Perfect.
And in terms of follow-up, you'll get, for those that registered, you'll get a copy of this webinar and a recording. And again, we thank you all for your participation, especially during a holiday week. Thank you, Laura, so much for co-hosting with me. You're fabulous, and appreciate your partnership always. Any other questions, feel free to reach out. And thank you all, and have a good rest of the day.
Great working with you, Becky. Thank you.
Thank you, Laura. Take care. Have a good rest of the week.
Bye-bye. You too.
Bye, everybody.